Welcome to another episode of the Embracing Joy podcast. I'm so excited to introduce our special guests with you all today, Dr. Nadia Sarwar, where we're going to talk about how to support mothers and children through anxiety and stress. Thanks for joining us today, Nadia.
Thank you so much for having me. It's a pleasure.
So, let me tell you a little bit about Dr. Sarwar. She's a double board certified pediatrician, and she's a palliative care physician. She's also certified in clinical hypnosis, and she's faculty with the National Pediatric Hypnosis Training Institute. She's also a trauma-informed parenting coach and the founder of Mumta Wellness, where she supports children and mothers navigating anxiety and stress. She's passionate about strengthening mothers' emotional resilience to create healthier generational patterns. Wow, this topic is so important. I know we have a lot of listeners that are mothers that are navigating stressful situations. So thanks for joining us again.
Of course. Thank you.
So let's get started with our warm-up game, Convergence, where we'll say the first thing that comes to our mind on the count of 3. 1, 2, 3. Music. Cat. Okay. Cat and music. Something that connects the 3. 1, 2, 3. Broadway.
Cat in the Hat.
Oh, I was thinking Cat in the Hat too. I really was thinking Cat
I don't
in
know
the
if that's one word.
But
I
it's
like
not one word.
Broadway.
That's why I didn't say it. Yeah. But I was thinking Cat in the Hat the same as you. I should have said it. So you should
That's
say
okay.
first thing that comes to your mind. So Cat in the Hat and Broadway, something that connects those two.
Oh,
But
right.
we can't repeat words.
Okay.
1, 2, 3.
Poetry.
I was gonna say musical.
Mm-hmm.
Because it's not exactly the same word as music, but
Yeah.
it is.
Yeah.
Musical and poetry, something that
Yeah.
connects those two. 1, 2, 3. Art.
Rhythm.
Art and rhythm. Okay. Something
Yeah.
that connects art and rhythm. 1, 2, 3.
Music.
Dance. Oh,
I'm back to music again.
we're back to music again.
Yeah.
Okay. Yeah. So we can't repeat the word, but so what's an alternative on the count of 3 that you would say?
Wait, which 2 words were we at?
We were at
Poetry and no, we were at rhythm and
rhythm
art.
and art.
Rhythm and art.
Mhm.
Okay. Rhythm and
Rhythm.
art. Are we gonna count to 3 again, or are you just waiting for my word?
Okay, let's start fresh again with
Okay.
1, 2, 3. Song.
Stanza? I don't know if there's stanzas in music. You're making my menopausal brain work really hard here.
Really hard.
Dr. Jen.
Okay.
This feels
Well,
like a game that my daughter makes me play, and then she complains that I'm really boring.
well, I think we had it at Cat in the Hat in the beginning because I
Yeah,
really
yeah,
was
yeah,
thinking
yeah,
Cat in the Hat.
yeah.
So we'll end the game a little short.
Okay. Okay, thank you.
Yeah, no problem. No problem at all. But it's just like there's no right answer. It's just to
Yeah, yeah,
to say what the first thing on our mind is.
yeah.
So with that being said, let's go right into our questions.
Okay.
Doctor, you work with both mothers and children navigating anxiety and stress. How do you see the connection between emotional resilience and joy, especially for high achieving mothers who often feel overwhelmed by their responsibilities?
Mm. Yeah, so this topic is near and dear to my heart. And the reason that I work with kids is I'm a pediatrician.
Mhm.
And the reason I work with anxious kids is because this is something that I dealt with my own children. And I saw it in so many of my patients. And what I also saw was that when kids are struggling, moms are struggling too, right? The two go hand in hand. And for myself and a lot of my colleagues, what I noticed was the tendency towards perfectionism. So when you're a high achieving professional, you tend to be a perfectionist in at least one part of your life, maybe all of them. So for myself, I was holding myself to a really high standard as a pediatrician, but also as a parent. And so a lot of my perfectionist tendencies were coming out in parenting as well. And when you're a perfectionist, it doesn't leave as much room for joy, unfortunately, because
Mhm.
as perfectionists, we're very much focused on controlling outcomes and wanting certain outcomes. And when you are so busy trying to control the outcome, it doesn't leave as much room for just curiosity and joy.
Hmm.
That's what I found.
Interesting. So, how can techniques like hypnosis and mindfulness help mothers and children manage stress and this perfectionism?
Yeah, so I'll speak a little bit about hypnosis because I think people know a little bit less about hypnosis than they do about mindfulness. So, clinical hypnosis is a technique that helps engage the imagination. And what that looks like is really deep inward focus or concentration. And the purpose of that is relaxation, but also it can be alleviation of a symptom. So, whether that symptom is insomnia or pain or whatever other stress related disorder someone might be dealing with. And the thing that you realize after doing this work is that many of us spend a lot of time in hypnosis. We are in deep inward focus, but we're focusing on the negative. We're
Mm,
focusing on all the negatives in the past, and we're focusing on all the possible negative things that could happen in the future. And so we're in a state of negative hypnosis. So, in a way, hypnosis, though it's not mind control, I'm never in control of the person's mind. I am teaching them how they can be more in control of their mind and they can choose to focus on the positive. So, with kids, it can look as simple as working with them on their inner dialogue. And adults too. A lot of times, without even realizing it, we're speaking about ourselves, about our surroundings, our situation, or the people in our lives in a really negative way. And what I would say is that just changing the language that you use when you have that inner dialogue can be really helpful. And this is different, by the way. I want to make clear that this is not toxic positivity where you say, everything's great, I'm so happy, even if you don't feel that way. It's more about choosing to focus on what you can say, which is positive, or even putting out there into the universe what you would like to see happen. Like, I want to feel better about this. So even if you aren't feeling good about something, you could say, I wish I felt better about this. And I think many times people don't realize how powerful the words we say to ourselves are. So that sort of ends up being the first lesson that I do with my patients is just working on what are the things that you're telling yourself about your situation.
mm. Yeah, words are so powerful, and we don't realize how powerful they are. Excuse me. With strengthening, let's talk a little bit about strengthening mothers' emotional resilience. What made you, well, you decided to care for mothers because you noticed that the children who were anxious also had anxious mothers.
I
But
did notice that, yeah.
but what are some key practices or mindset shifts that you recommend to mothers in particular?
Mm. Well, I approach each patient differently, so it sort of depends on what's going on. But what I would say is that I think that parenting is so anxiety inducing. And what's going on with moms a lot of the time is they are so attached to the outcome. They are so, which makes sense, right? Your kids, what could be more important than your children being okay? But when we get really, really attached to that outcome, is my kid going to be okay? Are they going to be happy? Then it produces anxiety. And when you are anxious as a mother, whether or not you think your child is picking up on it, they are. They
Mm,
may be picking up on your anxiety before you even pick up on your anxiety. And that's actually what I found in my own life as a mother as well. And maybe I could share a personal story that
mm,
sort of illustrates this. So, you can't control certain things. One of my kids, my second child, was born with some medical problems. And among other things, she suffered from recurrent UTIs. And and there was a lot of stress at the beginning of her life. She had multiple surgeries and things like that. And I thought I was handling it pretty well. But then, I started doing this work. And when you do this work, you also learn for yourself. So I practice self hypnosis and I've used my techniques and I know that they work. And that is sort of part of why I do this work. But I remember one day, a few years into like this practice, my daughter came out of the bathroom and she said, "Mama, it hurts to go pee." And I said, "Oh, okay. Oh, don't worry about it, honey. Let me run a hot bath for you. And, in a little bit, when you feel like you can go again, we'll just check your urine." I had test sticks at home. And she looked at me funny and she said, "What's going on with you, mom?" And I was like, "What?" And she said, "Usually when I say anything about my stomach hurting or about it hurting down there, you make a face. And today you're not making that face.
mhm,
Like, you don't like normally you make a really stressed out face and you didn't make that face." And so this whole time where I thought, you know, I'm disguising it really well. Like, yes, I'm really stressed inside, but my child isn't picking up on it at all. She was picking up on my stress.
mm,
And so I say that and I share that story with a lot of parents because kids have this radar for picking up on anxiety in their parents. And if as a child you can tell that your parent is anxious, that is anxiety inducing, right? Because if they're not okay, boy, something must be wrong.
mm, mhm.
Yeah.
Yeah, 'cause they're your adult figures that are supposed to be well, they're initially, you think of them as all-knowing, you're a parent, right? So,
Yes,
if you
that's
think
right.
that they're anxious, then, of course, that would make the children feel more anxious.
Yeah, absolutely.
Mhm. So, tell me who is a good candidate? Like, how do you know clinical hypnosis is the right treatment for someone?
Yeah. So most kids are really good candidates for clinical hypnosis because children have a great imagination, and that really helps. There is a peak age of hypnotizability, which has been studied, and that's usually from the age of 9 to about 13. So those kids are especially strong when it comes to hypnosis. But I do see kids as young as 4.5 or 5, and I do see children all the way into their early 20s. So there's no age where hypnosis doesn't work per se. I do think, just from experience, anecdotally, I can tell you that if you have a good imagination, then you tend to do well with hypnosis. And if you are more concrete in your thinking, perhaps not as well, but it's always worth exploring. And then I could tell you a little bit more maybe about what kind of conditions. I think I mentioned for sure anxiety, but also tic disorders, any sort of habit disorders, and functional neurological disorders, functional abdominal symptoms. In fact, most of the literature right now is about that has studied the use of clinical hypnosis is in
Mhm.
the setting of IBS and also pain.
Oh, okay. Very interesting. And then what was your inspiration to kind of study clinical hypnosis? Coming from you doing, working as a pediatrician and working in palliative care, kind of what moved you towards
Yeah,
doing clinical hypnosis?
great question. Well, one was my patients. I've worked as a hospitalist, I've worked in urgent care, and as you said, in palliative care. And definitely would occasionally see patients as a hospitalist where the symptoms would sometimes be dismissed by the team as supratentorial. We use that term in medicine, right? It's all in the head. And I
Mhm.
remember feeling this frustration early in my career about not being able to help these patients because supratentorial doesn't mean that the symptoms are not real for the patient.
Right.
They are still struggling, their families are struggling, so what are we doing to help them besides, a psych consult or telling them they're fine and they need to go home? And as I worked in pediatric urgent care several years ago, I saw the same thing. I saw lots of kids that were described as frequent flyers, and they would come in with these vague symptoms of abdominal pain or dizziness, and you scratch the surface and you realized, oh, they're really stressed out, or they're really sad, or they're being bullied. And of course, in urgent care, we reassure and then we send them to follow up with their pediatricians. But these kids were not getting what they needed. So at that point, I had not even honestly heard of hypnosis at that point in my career. But I started by studying mindfulness. And then my own son started to struggle with anxiety. And it was at that point where I was exploring all the options that I came across clinical hypnosis.
Mhm.
And we found someone that practiced that helped him. And then eventually I decided that I wanted to study clinical hypnosis, and I completed my certification a few years ago, and the rest is history. It's been life and career changing.
Well, I'm glad that you had that story. I'm glad you shared that story with us because it kind of ties in, how passionate you are about the subject of clinical hypnosis and how it has helped your family. And also, it can help these kids that you saw in urgent care and in the hospital that have conditions that need treatment, but that are not getting helped in the traditional practice.
Yeah, absolutely. I will say that very often we see kids who have already sought out help in other specialties. So, kids who've seen maybe multiple specialists, have seen psychologists, psychiatrists, and they aren't getting the answers that they're seeking. And of course, it is also important for them to see the relevant specialties, right? So I
Right.
never treat a patient unless I'm sure that everything that needs to be addressed has been addressed and they've had the studies that they need to rule out any organic cause.
Mhm. Mhm. So, with that being said, now it's time for our wrap up questions.
Okay.
Doctor, who is a model for joy in your life and why?
Oh my gosh, who's a model for joy in my life and why? I am gonna say my youngest patients. Like, I could have picked a pet or someone, like I have cats, but they're not the happiest, like, dogs tend to be happier than cats, but I'm gonna say my youngest patient. I would say my children, but once they're teens and up, they're not exactly models of joy anymore, but my youngest patients, those 4 and 5-year-olds or even up till, like, 8 or 9 years old, and they come in and with a symptom, and then we resolve it, and they're so happy. They're so happy with just sort of the simplest things, just to be able to sit in my office and draw while we talk. I think children truly model joy, young children who aren't
Mhm.
yet burdened by the complexities of life.
Mhm. Yeah, yeah, children really do model joy.
Yeah, yeah.
If you were baking a cake of joy, what would be the top 3 ingredients?
A cake of joy. Okay. A healthy amount of curiosity,
Mhm,
acceptance,
mhm.
mm, and just present moment awareness.
I love that. I love those ingredients. So, thank you again for joining us. That's the end of our episode. For
Okay, thank
any
you. Thank you for having me.
Yeah, it's been such a pleasure. So, for our listeners, please make sure to like this episode, share it with a friend, share it with a mom, or especially if the mom has anxiety and is looking for something that they maybe haven't found through traditional means. What is the best way our audience can contact you if they want to learn more about you?
I am going to refer you to my website.
Mhm.
That's www.mumta, M-U-M-T-A, wellness.com. And you can also find me on Instagram. It's just my name, Dr. Nadia Sarwar. Find me, follow me. I talk about my work and give helpful tips for parenting. And yeah, just always feel free to reach out. And if I don't feel like I'm the best place to help you, I will do my best to find the right place to refer you.
Thank you. Thank you so much. It's been such a pleasure. So please, now you know how to look out for not Dr. Sarwar's resources on her website.
Mumtawellness.com.
Mopta Wellness, excuse me.
No worries.
All right. Take care.
Bye.
Bye bye.